Yeah, so there are a lot of exciting updates happening in the MDS genomics field. Lots of progress being made, lots of opportunities at the same time. Challenges that we must address. Traditionally, we've known in MDS of cytogenetic aberrations that help us to achieve a diagnosis and indicate information about prognosis, and in some cases, help to guide treatment. More recently, there have been discovery of a set of recurring mutations that are associated with MDS. Some of these are at higher frequency, greater than 10%, but there are a lot of genes that are found at a much lower frequency. Looking at these mutations, they do group into certain biological and functional categories. So, for example, the top types of molecular aberrations in MDS affect the RNA splicing machinery, or the RNA spliceosome, which is fascinating. Is among cancers, this is the most prominent area where these types of mutations feature. Next up, we find mutations that affect epigenetics and regulation of DNA methylation and histone modifications that affect the accessibility of the chromatin. And then moving down from there, especially as MDS progresses, we see mutations in transcription factors and DNA damage response genes, for example, that portend poor prognosis. So these set of mutations are amenable to targeted sequencing. And so this is one of the first areas that has been emerging, is capturing this wealth of genetic information, including in targeted sequencing panels. A lot of attention has been placed on this now, and we are now at a stage where traditional prognostic features of MDS that are more based on morphology and cell counts and gross cytogenetic aberrations, that we are now seeing the integration of these molecular aspects into prognostic models and rapid evolution and refinement of prognosis. These molecular techniques have also now been giving us a new window on the traditional cytogenetic world. And depending on the resources that are available at a particular center, I'm a laboratory medicine physician, a hematopathologist. But these cytogenetic traditional techniques like karyotyping and fluorescent in situ hybridization, or FISH, can be quite laborious and costly, and in some cases can take quite a while to turn around. And so coming back now, though this is very rich and important information, coming back to the cytogenetics, there are emerging new technologies such as optical genomics, for example, or targeted approaches to looking at hotspot regions, or now coming back to the whole genome sequencing aspect. And so is it possible to replace the traditional cytogenetic workflow with a completely molecular and sequencing-based workflow where these gene fusions and chromosomal aberrations can be detected by molecular biology? And so these are some of the topics that we cover in the Genomics 101 session at the MDS Congress. And as mentioned, highlighting how there's a change now and opportunities to improve the practice and to integrate these technologies in the best possible way. And finally, as a laboratory physician, considering about standardization and opportunities for guidelines regarding how best to capture these variants in a standard way, so that we can apply this information, this molecular and cytogenetic information, in the most equal way to the greatest number of patients and clinicians to guide care in MDS.